He's been very lethargic for the past week or two and hasn't been making any progress to get better.
There's no better.
Yeah.
These are the kinds of discussions Dr. Gregory Thomas has every day. He's an inpatient palliative care physician at Sharp Grossmont Hospital in La Mesa. He's going over what an end-of-life care plan might look like with the hospital's clinical chaplain, Andrew Griffiths.
They identify as Christian. I need to find out what their denomination is.
Okay.
But I think they would be open to having spiritual care involved.
Is family in town too?
Griffiths and a team of volunteers are standing by, ready to comfort patients in their final hours who otherwise would have no one else. It's called the 11th Hour program.
The mission statement is, no one dies alone.
Griffiths says it's designed to give companionship to those at their most vulnerable.
When I think about death as a living person, I work around it, 8 hours a day, 4 days a week, but I'm still scared of death. And I would be really scared to be around not only death, but be around death alone.
Any hospital staff member can refer a patient to the 11th Hour program. Griffiths says when they get that call, they know that the patient is not going to get better, and they're typically on what they call a comfort care plan.
They're kind of the end of their illness journey. They've gone through fighting, they've gone through the various levels of what an illness will do to a body, and then they are towards the end and they're actively dying, means they're nonverbal, they're unable to speak. In general, they're usually older population.
Griffiths and his team try to get as much information about a patient as possible before spending time with them, like finding out their favorite music or books.
Maybe if they love the Beatles, playing a Beatles song. If they love poetry, maybe reading some poetry. Showing that the act of I see you, I'm with you, I'm here.
The 11th Hour program is just starting back up again after a nearly 3-year hiatus due to COVID-19.
That was a bummer for us because I really think that would have been a good time for our program.
Tamara DiBelso is an 11th Hour volunteer and also a physical therapist at Sharp Grossmont Hospital. She's been with the program since 2015. She says it was tough not having it around during the deadly pandemic.
It was probably when we were most needed, it seems. Because lots of patients had to die by themselves. Their families couldn't come into the hospital, and the nurses were, overwhelmed with lots of things happening at the time. So I wish we could have been there, but that wasn't an option. So now we're back, which is good.
The program is looking for more volunteers to help reach a goal of having someone available 24 hours a day. Majority of the patients are not able to speak, but they can usually hear.
I hold their hand and just talk to them and just tell them that, it's okay and that they're safe and that they're in a good environment and that they're being taken care of.
DiBelso didn't think twice when she was asked to return to the program. For her, this work is personal.
It sort of resonated with me because I've been present at the deaths of 3 of my family members. And those were different kinds of experiences, but the common theme was that we had so many family members around at the time. And for someone to go pass on their own without anyone just didn't seem right to me. But I think it's more of a comfort to the patient as well as yourself, just that you can provide someone maybe a few moments of peace.
Make it feel more comfortable.
Griffiths says over the last couple of years, he saw heartwarming scenes where nurses and therapists took time out of busy schedules to spend time with those dying alone. He jumped at the opportunity to help restart the 11th Hour program, and he's hoping more volunteers will help it thrive.
I want to live in a world where there's a little bit of hope, and so I think this program is one step towards that, of bringing hope back into the world.
The 11th Hour program falls under the hospital's spiritual care division, but volunteers don't have to be religious to get involved.
Thanks so much for watching KPBS on YouTube. I'm health reporter Matt Hoffman. If you like what you saw and you want some more content, click that subscribe button.